this is Ramavath Abhilash. I'm a second year medical student. May I know your name, please? Sure. Okay, what's your age? 21. Okay, today I'm going to examine your cerebellar testing. Is that okay with you? Okay. Okay, can we start now? Yes.
Show the patient how to strike one hand on the thigh, raise the hand, turn it over, and then strike the back of the hand down on the same place. Observe the speed, rhythm, and smoothness of these movements. Repeat with the other hand. The non dominant hand may perform less well. Now, test rapid finger tapping. Show the patient how to tap the distal joint of the thumb with the tip of the index finger, again as rapidly as possible. Again, observe the speed, rhythm, and smoothness of the movements. The non-dominant side often perform less well. Now, legs. Ask the patient to tap the ball of each foot in turn as quickly as possible on your hand or the floor. Note any slowness or awkwardness. Normally, the feet do not perform as well as the hands. Now, point to point movements. In finger to nose test, ask the patient to touch your index finger and then his nose alternatively several times. Move your finger so that the patient has to change direction and extend the arm fully to reach your finger. Observe the accuracy and smoothness of movement and watch for any tremor. Now ask the patient to close eyes. Normally the patient touches the examiner's finger successfully with the eyes opened or closed. These maneuvers test position, sense and the function of both the labyrinth of the inner ear and the cerebellum. And this completes the finger to nose test. Now the legs. Heel to shin test. Ask the patient to place one heel on the opposite knee, then run it down the shin to the big toe. Observe this movement for smoothness and accuracy. Repetition with the patient's eyes closed. Test for position sense. Repeat on the other side. Now in gait. Ask the patient to walk across the room or down the hall, then turn and come back. Observe the posture, balance, swinging of the arms and movements of the legs. Normally balance is intact, the arms swing symmetrically at the sides and turns are smooth. Now walk heel to toe in a straight line. This is called the tandem walking. Tandem walking where reveal ataxia that is not otherwise obvious. Now ask the patient to walk on the toes, then on the heels. These test plantar flexion and dorsiflexion of the ankles as well as balance. Walking on toes and heels may reveal distal leg weakness. Inability to heel walk is a sensitive test for corticospinal tract damage. Now ask the patient to hop in one place. Hop in place on each foot in turn. This tests proximal and distal muscle strength in the legs and requires both normal position sense and cerebellar function. Now ask the patient to do a shallow knee bend. First on one leg, then on the other. Steady the patient if you think the patient might fall. Difficulty doing shallow knee bends suggests proximal weakness of the quadriceps. Now stands. There are two tests. First, the Romberg test. This is mainly a test of position sense. The patient should first stand with feet together and eyes open and then close both eyes for 30 to 60 seconds without support. Note the patient's ability to maintain an upright posture. Normally, any swagging is minimal. In ataxia from dorsal column disease and loss of position sense, vision compensates for the sensory loss. Now test for pronator drift. The patient should stand for 20 to 30 seconds with eyes closed and both arms held straight forward with palms up. Normally, patients hold this arm position well. If necessary, patients can be tested in the sitting position. Next, instruct the patient to keep the arms out and eyes shut and tap the arms briskly downward.
Okay, now this completes your entire cerebellar testing examination. Okay, thank you for your cooperation.
Thank you.